we will now shift to listen to a series of short presentations from researchers affiliated to Swedish institutions with focus on knowledge gaps and ways forwards in their field. First, we introduce Mats Blennow, who is a professor emeritus at the Karolinska, perinatal neuroscience, but also been working in the Guideline Development Group for WHO recommendations for the care of preterm and small low birth weight infants. Over to you.
Thank you, Morten. Thank you. Welcome, everyone. And I'm very grateful to the organizers of this meeting to be allowed to talk a little bit about the work we did within the Guideline Developmental Group, following developing the new guidelines for newborn and preterm. Doesn't work? So this is a spin-off, and it's an exercise that we did within the group of 25 people from all 5 continents, including also family representatives and other stakeholders in the process of developing the new guidelines. And I will be brief.
Yeah, the green one, yeah.
So the process was for developing the new guidelines that were actually born a year ago at the World Prematurity Day and published. There was a WHO evidence synthesis team that did all the digging into what is the evidence out there for how to improve. I hear myself. Yeah. I'm sorry. Then the Guideline Development Group, where I was honored to be one of those 25 participants that met for full-time 5-week work to develop. It was quite a lot of homework in between that too. So we really tried to tease out what is the evidence out there for different interventions. And we tried to identify priority questions, outcomes, a retrieval of the evidence, and then had to try to assess and synthesize this evidence and formulate the new recommendations. I guess you all have seen these and read them. And the scope were divided into preventive and promotive care, care for complications, and family involvement and support, which was a little bit new and was actually the most exciting part of it all during this period, and having a look at the short and long-term outcomes. So as a spin-off of this, we did actually also identify knowledge gaps resulting in 36 different research questions that were identified. And 32 out of these 36 would generate additional evidence for aspects of the effectiveness of the intervention that we identified, and 4 of them they should be implemented, the new interventions. And 7 out of the 12 high-scoring interventions were newly recommended ones. So this was a sort of funny exercise that we did. We voted. We had 5 votes each for these 32 different interventions. And they were not stratified, so they had equal weight. And then we just counted what were the most favored interventions to be prioritized. And the top of them were these 4, that the strategies to increase the family participation. And that's a very interesting one, I think, because there is a lack of family integration in our care in the high-resource settings, but it's nothing. Okay, now it works. Okay, I still can hear myself. Number 2 was the exclusive breastfeeding, how to promote that and how to support and how to scale it up for the preterm baby and the low birth weight infant. A little strange strange intervention for us in the high resource setting is the effectiveness of emollients in the neonatal care. We rarely use it, but there was a lot of support for this one from the lower resource settings where it's very frequently used. And the fourth one was to compare CPAP to high flow nasal cannula for respiratory support to preterm babies in low resource settings. In the second tier, receiving 5 votes each, was the effectiveness of IKMC in improving mortality, morbidity, and other outcomes for the critically ill preterm low birth weight infants. Milk banks were discussed a lot, and how can these be constructed, and how can they be made effective, safe, and feasible in the low resource setting. And probiotics, which is very much on the agenda today due to a few deaths in Northern America. But if it could be effective and safe, and what would be the consequences on mortality, morbidity, and other major outcomes. So to summarize this, there are still pressing research questions out there. These are only a few of them. And there has previously been prioritization exercises done for preterm infants, and they have ensued answers many key questions, but there are still a lot of questions left out there. And we propose a robust, diverse research agenda, but most of all, we call for governments, NGOs, and other research institutes and donors to evaluate and support the top-ranked suggestions that we made. Thank you.
Thank you so much, Mats.